Up first on this Parenting and Education Tuesday, we are going to focus on before you have that baby and women's health. Many women make a birth plan but fail to put themselves on that plan. It's so important to have self-care as you prepare for birth, recovery, to make sure that your health is at the top of the priority list. So I recently spoke with two great individuals all about this. Let's take a look.
If you're expecting a baby or considering it, this story is for you. With all the anticipation and excitement a new baby brings, a woman often forgets one key element when making a birth plan, which is herself. Too often, women don't talk to their doctors about ways to improve recovery, steps to take to maintain a strong body, and manage postpartum pain. Joining us live is Dr. Marcy, known as social media as the Down There Doc, and distinguished anesthesiologist Dr. Shastri, who are both Vistero Biosciences consultants. Thank you so much, both of you, for joining us.
Of course. Thanks for having us.
Dr. Koch, let's start with you. Help us understand some of the main things that happen to women's bodies during and after pregnancy, and how can women support the recovery after the baby is born?
Yeah, such a great question. So there are a lot of things that can happen to a woman's body during pregnancy and after, and there's no denying that this is a demanding physical event. I tell my clients all the time that having a baby, being pregnant, going through the process of labor and birth, it's like a major athletic activity. So we need to be training for it and recovering for it, just like high-level athletes do. So some common things, but not normal, that can happen after baby are leaking urine, chronic or acute pelvic pain, sexual dysfunction, difficulty with vaginal penetration, pelvic organ prolapse, abdominal muscle separation, C-section scar, sensitivity and pain, core weakness, and so much more. So these women are really dealing with a lot of these issues because they are so common, but not normal. So pelvic floor physical therapy, seeing someone like myself, really help to not only prepare the woman for the actual event of labor, but also helps her recover the right way from day one. And then we see better long-term outcomes, improved quality of life, and less of those symptoms like I mentioned before.
Dr. Shastri, speaking of recovery in terms of pain management, what should women be discussing with their doctor in preparation for delivery, especially if they have a planned or unplanned C-section?
Absolutely. Great question. No matter how women deliver, whether it be vaginal or C-section, one of their main goals is to get home as soon as possible. Understandably, this is harder after a C-section delivery as there's a lot more pain associated. Yet, C-section moms are still expected to do all the same things: hold their baby, feed their baby, walk around, and look after themselves, all within the first 24 hours after having surgery. Primarily with C-sections, especially unplanned ones, the mainstay of pain management can be opioids. Opioids have a laundry list of side effects that can delay recovery, including nausea, vomiting, constipation, drowsiness. I encourage all women early on in their pregnancy to talk to their doctors about what non-opioid options are available, especially if they end up in a situation where they need a planned or unplanned C-section.
Also, Dr. Shastri, are there alternatives to opioids available to relieve pain? And what if your doctor doesn't offer them?
Absolutely. There are lots of options. In my practice, I like a medication, Exparel. It's a long-acting numbing medication that we inject into the surgical site at the end after the baby's out. Exparel lasts for a few days while the pain is at its worst, keeping the area numb. Usually when Exparel is on board, patients just have some minor breakthrough pain that can be treated with medications like acetaminophen, and we can avoid opioids altogether. Women can learn more about Exparel at exparel.com/safety. And you ask a great question about what to do. So if your doctor doesn't actually bring it up, I think it's really important for women themselves just to start the dialogue and ask the questions. And I think everyone will be pleasantly surprised to find that their physicians want to work with them to accomplish what their recovery goals are.
And Dr. Koch, what are the benefits of an opioid-sparing recovery after childbirth, whether it's through physical therapy or the use of a non-opioid option during and after delivery?
Yeah, so so many. And I think things that we really have to keep in mind here are that, remember, these tissues just went through a lot, right? They went through a delivery, perhaps there was a surgery in the abdominal wall, maybe there was some trauma to the perineum or the pelvic floor muscles. So some of the side effects that come along with opioid medications, like nausea, constipation, vomiting, that sort of thing, it puts extra pressure on those tissues that are already sensitive. Like, we don't need to, women are already constipated after having a baby. We shouldn't add to that if possible. So using non-opioid type medications and therapies like physical therapy can really help set the recovery process up the right way from like minute one. So we see better outcomes long term. Pelvic floors are more supported. There's less pain. Women can be more present during this really transformative time. And we see better kind of connection and quality of life because pain is down. They're not worried so much about what's going on down there. And they're really able to heal and recover in a very supportive way. And that's just so important for new moms.
And where can we get more information?
People can go to www.wearewomenshealth.com to learn more.
Well, thank you so much, both of you, Dr. Crouch and Dr. Shastri, joining us from Pacira Biosciences, for giving us this important information for women who are getting ready to have a baby or post-delivery. Really important to help manage their pain and take care of themselves. So thank you for your time.
Thank you.
Yes.